1, 2, 3.
Good morning.
I'm going to try my head high. I'm going to try my headphones first to see if the headphones came up better. Or Vaughn, actually, I could work with. We're having, the problem was that I always have to use the iPad because I wasn't sorted out on the computer. I'm a Mac person, but I have this Lenovo, which I bought the microphone for because I don't have a mic for the other. And not a mic, a visual camera. Bottom line, I've never been able to get the settings right, so there's no squealing or what have you. So I would like somehow to get louder volume. You guys are coming off speaking softly, even though you can hear me. I can't make my volume louder to hear you. That's why I was testing the phone. I can't hear you now. Yeah. Well,
So the issue is that if you turn up any louder, the mic catches it.
yeah, she's having trouble. If I was on the phone, Loretta was having trouble. Right now, it's just that if everybody speaks in a comfortable voice, I'm really straining. And I tried to plug in my earphone. That didn't make it better. I couldn't hear, it blocked it.
How about after this, we can screen share your computer and I'll see what sort of settings we can mess around with that might.
Let's not do it when people are on. We'll do it afterwards or another.
Yeah, let's do it
Okay.
after. That's what I mean.
Okay. But if everybody can be clear, I'll tell you if I can. If worse comes to worse, I'll go back to iPad again, which is what I've been using all the time. Let me try to sign in on the iPad. Scotto said he couldn't come today. He's away, but he wants to see the recording.
We have 12 people on. We'll wait a little bit longer. Obviously, we're waiting for Diane mostly today, too.
I'm not sure if Diane will be joining us, and if she is, it will be at a later time. So I think if everyone else is ready, I think we're good to begin.
But Vaughn, are you taking over? This was her meeting.
I am taking over this
okay.
meeting. So
Okay.
today we're going to be going over the exam that was recently announced and is out now, the high cap exam for all of us to take, the 50 questions that we usually take every year. I'm going to be going through it with you guys, reviewing, picking out a couple that I thought were a little bit challenging. We're going to go through it all together today. But before I jump into that, because that's going to take a while, is there anything else that anyone has to say?
Yes, that was not my understanding. That we're not going to go through the thing today. Nobody did their initial work on it.
Mm-hmm.
Maybe next meeting, but we want people to work on it.
Okay.
I thought it
Let me
was
at least show
today.
you where
But you
it is.
could give hints of what to look out for. Yes, that we expected, but not a one by one.
Sure.
My understanding was.
So
that
let me at least show everyone, in case everyone doesn't know, where to find the document. So I'm just going to share my screen for a quick moment.
So annoying.
Bear with me. All right, here we are. So I have this message scheduled out to go to you guys right after this meeting, but this is the message that was sent last week from Heather Leddick regarding the exam being open, the annual High Cap Counselor Exam 2022. Now it's available on the shiptacenter.org website, which you all have a login to. If you don't, reach out to me and I can help you get the reset if you don't remember your username. But if you don't remember your password, there's a way to reset that in the system. So I'm just going to open this up and show you an example of how to get there. So this is the SHIP help website. Everyone has access to it. What we're going to be looking for is the SHIP login right there at the top of the screen. Or you could jump straight into this website by going to portal.shiptacenter.org. But the email that I just jumped into this from, I'm going to forward to all of you at the end of this meeting. Whatever password you originally used for the SHIP website is the same password. I don't believe it expires.
.gov.
.com actually.
.com. Okay, sorry.
Thank you. Okay, so once we're into the system, we're going to be looking for the exam under Training and Certification, OCCT, this little green button up here. And then once we're there, we're going to click over to Certification tool. And then we're going to see all the exams that are available right now. This is the one in question, the annual High Cap Counselor exam. You'd be able to click the button and jump straight into it. It's 50 questions. There are a couple of tricky ones, so please feel free to give it a try. You can take it as many times as you have to. Once you take the exam, as it has been in previous years, it will let you know what your score is immediately, and it will highlight which ones you got incorrect and show you the correct answer. This is not really an exam to scrutinize you. This is more a learning exam. It's an open book exam. You can use all of the resources that are available to you, including our High Cap notebook, which the link will be sent to you, and anything available on any one of these MedicareInteractive.org pages. These two will be your Bible. Anything that you want to know that is on this test is listed in these two sources, open book exam. So since we're not ready to go over it, that's completely fine. We can schedule that for next week. I just want to let you guys know it is available. It's up. I'll be sending you the link right after this meeting.
I have a question. Is there any way we can go over some of, I spent the weekend doing the exam and canceled a meeting this morning thinking we were going to review the exam. Is it possible to discuss the exam a bit? My understanding was that was what this meeting was all about.
So it seems like there was a miscommunication, but I'd be happy to cover it. It just depends on what the group is willing to do.
Oh, there was no miscommunication. I agree with Marianne. She just wrote in the chat. We knew that Diane was going to. She's always said it to me privately, and she's always, and this is what I've conveyed to everybody. It was never a one-by-one thing. However, it was going to be highlights of what you can expect, where the problems are. Definitely that, no question. That's why I was surprised that she's not there. Since you're going to do it, that's fine. But definitely we want to do a real deep dive into the exam. We just want to give everybody 2 weeks to look at it. It was so quick that she sent us the link that not everybody had a chance to actually do the study. And the concern on some of us was that when you get answer by answer by answer too quickly, then you kind of fall back. Some people might decide to do it that way rather than deep dive themselves. The deep dive is where you learn stuff. So it's a delay, but it's not I'm sorry you misunderstood. I never meant to say it that way. It was never said that way on my part. But we have this concern. We don't want anybody sliding because we're responsible for ourselves now. We're not overlooked. We're overlooked by Diane. She's facilitating, but we are a unit that's working as equal counselors trying to make this thing excellent. So we don't want anybody like we want everybody to put in hours of the study to make sure that it's a viable, legitimate organization, or, or we have nothing, it falls through the cracks.
But if anyone does have a question about something that they did see on the exam, they haven't gotten a chance to look at it, they are stumped by a question, they want to know more, we can definitely go over that right now if anyone has a moment, or right after we're finished with everything else, because it could turn into a longer discussion.
Thank
So
you.
we could save that to the end, definitely. And if anyone would like to stay over time, we can definitely do that.
I'd rather focus on the exam.
Okay, so beyond the exam, what else was on the agenda today?
There really wasn't anything else on the agenda today.
Diane asked for this meeting. We didn't make an agenda because she was the one who said she wanted to address everybody. She originally talked to Krishna about this 10 days, 22, many days ago, because she wanted to come in on the 13th before we knew about the exam. And then we said, no, she's closed. Your library is closed. So we moved it. We made the schedule change, but this is weeks ago, she asked for this meeting. So we built it in for her. We didn't make our agenda.
Okay, so it seems like the only thing we really have to discuss is we can definitely go over the harder or the more difficult, the more tricky questions. And then if anyone has any questions that they'd like to throw out about the exam, we can definitely go into that. So let me just pull up everything, and I'm just going to show you a couple of the highlighted ones that I saw and that others I have known have struggled with. Now, we were going to use, originally when we talked about this, we were going to use the practice exam that the coordinators used, but since that time, the real exam has become available. We didn't know when it was going to be released, and now we know it's available right now as of last week. So let me share my screen again, and we'll jump straight into that. All right, so a couple questions that I thought we would benefit in going over from, well, of course, this is the exam, 50 questions, like I said. A couple questions that I thought we could benefit in going over was question 4, for example. Now, question 4 says beneficiaries with extra help LIS whose plan is terminating, or with full LIS whose plan is no longer a benchmark plan, may receive which colored letter from CMS to notify them that they are being reassigned to a new Part D plan for the following year.
I'm sorry, Vaughn, please let me interrupt. This is really not fair because it's going against, this is kind of thing where I put information to do the research on the website. It's like these kinds of questions are easy peasy questions for us. So for you to determine what we need is really wrong way around. We've been doing this for years.
Okay,
we need to know what we want, where we have our problems with. That one is, there's a complete, I put a document on the SBIC Documentation Center of what color goes with which one. That's an easy lookup. There's no discussion about that. Why can't we want it to generate from us, not top down. This is our work. And Diane was going to throw a few areas, but she wasn't, this sounds so much like it used to be. You telling us answers or going over, that's not right. That's exactly contrary to what the purpose of our studying is.
Okay.
Let us tell you where we had problems.
I understand your point, and we can definitely flip it around. Does anyone have any questions that has seen the exam that they'd like to review? Let's start there.
Yeah, I mean, Marna and I came up with a couple that we didn't quite understand, right, Marna? Yep. So let me go.
From the top, let's start.
No, it isn't from the top because 6 of these questions are exactly the same as last year.
I know, but starting from descending order from 1 to 50, whichever one in order, so we could just go down that way. Which was the first question that you thought was in need of further discussion?
See, my problem was that I have to go find it on mine because I didn't even expect this to happen today. I expect Diane to talk, and now I have to go find where I have my old, here it is.
All right, Marna?
I would like this, it's Loretta. I would like question
Sure.
to be explained. I really don't understand how they got to that answer. I did a lot of research and
Which question was that?
outside, 3. It was about, well, outside of public health emergency, most people with Medicare that receive the following have to recertify their eligibility each year. So basically it boils down to most of the people with Medicare that receive the following have to recertify their ability each year. And I don't,
But I can't understand you. It's very difficult today to understand anybody from my point of view. Do you have a number of the question? And will we
The
show it?
question number is 3, if anyone couldn't
Great,
hear.
thank you.
So regarding question number 3, if anyone didn't hear it, it is just as was read, outside the public health emergency, most people with Medicare that receive the following have to recertify their eligibility every year. Now, this is sort of a process of elimination question. We know that with Epic, most people don't have to recertify every year. And we know that with Extra Help, most people don't have to recertify every year. But if we were to go on to the MSP website, or we were to go on to MedicareInteractive.org and go to the MSP page, the Applying for Medicare Savings Program, we could see further down the page that to recertify, let me pull that up.
this also doesn't really say every year. It says sort of at their discretion.
So at the bottom of the document, it does list, if you were to just go through each of the documents one by one regarding those 3 programs, at the bottom of this one, at least, it does say that if you are approved, you will need to renew or recertify your MSP every year. If you don't receive a notice in the mail to recertify, you should contact your Medicaid office and ask what you need to do to make sure that you receive those MSP benefits for the following year. So like I said, this was sort of a process of elimination question. You'd boil it down to knowing that it was only MSP.
But then the tricky part of that question is the word most,
Yeah.
right? That's where I had trouble with this one too. Most.
Because Epic has, you have to, well, Epic terminates at the end of the year. So you do have to reapply.
No,
So,
no, people carry their card.
No. Julie.
Go ahead.
Yeah, it's Michelle. With Epic is looking at your tax return. That's how it's, so that's what I was wondering about that also, because so there is a bit of a recertification. If your income goes up, you don't qualify anymore. Case closed. So that to me is a certification.
Me too.
And Epic is only good until December 31st.
Yeah, but you don't have to reapply as a member of Epic at that time.
That's right.
The
Tell you.
state goes back, looks at your tax return and tells you whether you are still eligible. You get a letter.
So you are recertifying in a way, but it's automatically,
Yeah,
they're looking at
exactly.
it for you.
Epic does not check every single members every year.
Well,
They-
it must probably.
They do a random, well, however their method is, but so in that sense, you don't recertify every year. But your membership is continuous.
Right.
But regarding MSP, yes, most people do receive that recertification letter. And if they don't, they should contact the Medicaid, and then they'll be able to have their MSP for the next year, the next
Definitely.
calendar year. But the other 2, it's more of an automatic, or most people don't receive it. That's the key. A lot of these questions on here, though, some of the ones that I was going to go through, the wording is a little bit tricky. They're going to throw in words like most, or they're going to change it to, let me think of another example without looking at it. They're going to say all, words like all, or strict words like no. They're going to throw those in there that'll change how the answer is supposed to be. So you have to look out for those. Next question.
10.
Or 8.
10.
Okay.
You said 10 or 8?
Either
8.
one first. I mean, she wants to do 8. I had 10, the 10.
All right, so just go in order. Let's do 8. So 8, if everyone can't see it, it says, question 8, Medicare eligibility for federal retirees covered under the Federal Employees Health Benefits, that's the FEHB program, can elect. The options are FEHB and no Part B, FEHB and Part B and Medicare Advantage plan, and suspend FEHB, or any of the above.
Yeah, any of the
Now,
above.
the answer, correct, is absolutely any of the above, because FEHB and Medicare, they don't interact necessarily. They're parallel. So you can have both. You can have one or the other. It really doesn't affect each other in that sense.
But
So
if
you can have, go ahead.
I'm sorry, if you don't elect Part B though, and later on you choose to elect Part B, will you be subject to a penalty?
Absolutely.
Yeah, I didn't know. I tried to look this up and I didn't know where to look.
So let me see. I tried to say where I got everything from. That was question 8.
Medicare and U book.
Yeah, I looked in there. Was this in the Medicare and U book?
So this is on the MedicareInteractive.org website. So the Medicare and You handbook, the HICAP handbook that we have, and the MedicareInteractive.org are going to be your 3 best sources for this exam and your counseling in general.
Thank you.
So this is the page that they have on the FEHB basics. And I'm trying to find the exact phrase that answers that question. Okay, so it doesn't say it doesn't say here in completion, but this part does talk about it right here.
Got it.
Right.
Thank you.
Just
Yes.
slightly. But yes, that's really the gist of it. The answer is all of the above, because you don't have to have one or the other, or you could have one or the other. They don't really interact that drastically.
Thank you.
Now, question 10. All right, so this one was a little tricky. Absolutely, the 5% New York State limiting charge does not apply to. Now, the options here are non-physicians, home and office visits, and services provided outside of New York to beneficiaries that reside in New York. Now, the answer, if anyone's wondering, was all of the above. Now, for this one, I scoured it and I don't think I could find anything as to why this answer was true. But I do know that these individuals are allowed to charge up to 15% limiting charge.
Right.
Not 5%, 15 for a home and office
But in
visit.
New York, it was just
In
5.
New York?
Yes,
It's 5.
No, the home and office visits is 15.
Yeah, it excludes that home and office and the non-physicians.
it excludes all of the,
The first 2 were right. You knew it had to be all of the above, just by process of elimination.
yes. So all of these are not the 5% New York State limiting charge, it is 15%. So that's just something to look out for. Not 5 for these, 15.
But why is it that we can't find this somewhere, anywhere at the state level to that third one?
I wouldn't be able to tell you the answer, but I'm gonna take a look. I'm gonna speak to Diane and whoever else I can speak to find out why that isn't accessible anywhere else. But absolutely, if you know that the first two are true, it's sort of a process of elimination.
Well, it's not true. On the test before, they've allowed two answers sometimes. It doesn't say choose one.
No.
Now, I've seen it at one time. It said there were two things circled. But I don't know, take it back, but it could, the way it's worded, it could mean you could choose two of them and not choose all of the above.
Yeah, absolutely, if you had the option to. But I don't think any of these allow you to, this year at least, don't allow you to. All right, so, but I'm gonna take that back and find out where, if anywhere, it does say this, because I actually haven't seen that written anywhere else either. Does anyone have a next question? Just going down the list.
Number 10.
Did that.
I think we just went over number 10.
I know you did, but I couldn't figure out what was left that was subject to the 5% surcharge. If office visits and physical and various forms of physical therapy and other services are exempt, what is subject to the 5% rule?
The lab test, right?
Physician.
All other services.
Well,
Yeah.
but most services are performed in the office, aren't they?
No, lab
Well,
tests. the
lab
Part B.
tests.
All right, lab test is one thing, but
All your tests.
no doctor or professional charge is subject to the 5% rule, it seems.
It seems like you're saying, most of the services that are provided do fall under those three categories, especially when it comes to home and office visits. So yeah, the 5% doesn't come off all that often, but yes, lab test is one of them.
Anesthesiologist in a you know, like in an operation, that's not an office visit.
Well, it depends whether it's inpatient or outpatient, maybe.
I don't think so. I think it's a
No.
procedure. It's a code. I looked this up once a long time ago. It's a certain specific code for those home office visit thing. And that's not the same as having a procedure done.
Okay, I can live with that.
If you look at your CMS, your office visit is always separate from the rest of the services you receive. So your office visit is not subject to the 5%, but everything else would be.
Okay. Thank you.
All right. Thank you. Moving on. Does
The
anyone else have
office
any?
visit is at 15%? Is that what you're saying?
15%
Yes.
for non-participating providers, people that say they won't accept just the Medicare approved amount as their payment. All right, so I can't see all of you right now because I'm sharing my screen, but does anyone have any other questions beyond number 10?
29,
29, moving down.
I think. Yeah, 29.
29 was the tough one. '29 was another one, just like you guys. I wasn't able to find anywhere in either of our resources or either three of our main resources that said why. So I'm going to take that one back, and I'm going to have to come back to you in our next meeting, or I'm going to send out an email regarding why that is true. Question 29 and the one we just
Vaughn, Marta and I thought that the reason for that might be because it's automatic.
It's because you have to be retired and collecting Social Security, retirement benefits. You
No,
qualify for Part A.
No, it doesn't say qualify. It says you must have
must
it.
take it. That's the problem.
You have, Well, I don't think it says you have to take it. It says,
No, it does. I've looked that up.
That's-
It completely says you don't have to take it. You don't have to take Medicare and Social Security. But the point is that in this question, SS puts you there automatically
In Part A, right?
in Part A, right? So that's the problem.
Once-
So that might be the tricky part.
Yeah.
Once you meet these requirements that are at the top, you're single, you're over 70, and you're retired and collecting Social Security.
Yeah.
Now, when it comes to that, I don't think it'll be that much of a burden for most individuals, because if you're collecting Social Security, you probably, most likely, have over 10 or your 40 quarters, over 10 years of taxable income. So you're probably going to have premium-free Part A anyway. So it's no skin off of your back in that sense. But I'm going to find out exactly why.
Additionally, you are not obligated to take Part B and Part D.
No.
Those are optional.
Yes, just know that you will pay the penalty if you ever decide to come back
That's
into
right,
the
but
fold.
those are options. There's
Yes.
not requirements.
Yes.
So
But like I was
it's a matter
saying,
of
it-
elimination.
How about 28?
28. All right, for anyone that can't see, 28 says people with Magi Medicaid through the exchange who later become age 65 either cannot delay enrollment in Medicare Part B without penalty or automatically receive full extra help /LIS, or can initially receive MIPP, that's Medicare Insurance Premium Payment. And we're going to talk about what that is, Part B premium reimbursement. Now, we know that individuals who were on Magi Medicaid, once they become eligible for Medicare, they do have to take it. So they cannot delay, once they become eligible, they can't delay enrollment in Medicare Part B without a penalty. They can definitely go without it, but it's not, you won't be without a penalty when you decide to take Part B. So you know that's true. Now, because they are Magi Medicaid, they usually have the income limits to qualify for full extra help LIS. And so they are actually automatically enrolled. Now, the one that I think threw off a lot of people, and I could be wrong, but this is what I'm assuming, is the MIPP, the Medicare Insurance Premium Payment. That's not something that I believe in New York State, at least, we encounter very often. But the answer is actually all of the above. Now, the answer is all of the above. Like I said, this is question 28. Because those three things are true. They can't delay. They are automatically enrolled, because if they qualify for Magi Medicaid, they likely qualify for these two as well. And so they're automatically enrolled right into it. It's just a nicety. It's a great program. They don't have to fill out any extra or additional paperwork to start the process. And MIP is a little tricky. Now, I have this document on it, which I'm going to forward to all of you and explaining what the Medicare Insurance Premium Payment Program is. It's sort of like MSP for individuals that don't outright qualify for MSP, because they fall into 5 select groups of specific individuals. For example, individuals that are in the Medicaid buy-in working people, if individuals that are using a Medicaid buy-in for working people with disabilities, parents, caretakers, relatives with Magi-like budgeting, and the rest of these. But like I said, I'm going to send this document out to everyone else, because MIPs or MIPPs are not something that we encounter very, very often. They're like MSPs, but they are different, and this document explains why. Beyond that, so beyond that, does anyone have any other questions? Just things that they were stumped by?
133, could you explain under what circumstances you might lose coverage on any of those during the year?
Okay, so for, let's see, question number 33, in case anyone can't read it, it says, outside of the public health emergency, which might a beneficiary only lose at the end of a calendar year instead of during the year? Now the answer.
The answer is extra help, LIS.
Right.
I'm more curious as to, well, I don't understand the circumstances any of them are lost during the year. Let's put it that way. Under what circumstances do you lose these things during the year? Presumably you qualified for them. Because it says lose. I mean, you can't lose something unless you qualified for it. So how do you lose it? I mean, Part B, you don't pay for it, you lose it. But the other one.
So that was the first one I was going to tackle. Part A, Part B, the Medicare Part B premium. You don't pay for it. After 3 months, they cut you off.
Right, that I got, but the others, I just.
Basically, I think it comes into the windfall if you sold a house, if you've gotten an inheritance. I think that's when it happens during the year. It's not that frequent, but I had a client who it happened to.
Yeah.
Wouldn't that just affect Medicare savings program and extra help as well?
Extra help, for some reason, always runs until the end of the year when you lose it.
Right.
So that.
But the other ones you can lose throughout the year if your income changes for some dramatic reason, or you stop paying the premiums. You can lose it, but extra help, they only review you or recertify you at the end of the year.
They always let it run that long. I mean, and I can't remember if that's in where I read it, but it definitely is there. I think it's in Medicare and You.
So you're saying if you inherit something, or you, like you say, you sell your house, you lose your Medicare savings program and you lose Epic?
If you
Yeah.
if that transaction puts you outside of the income eligibility, yes.
No, but you have to report it, Vaughn. I think you can't, they won't know that you've sold your house.
Right.
So in other words, the change of status, you get
Don't
divorced,
count
you
on
get
it.
married, you got to report that to those places, and that it will change during the course of the year. The list thing goes to the end of the year. Like with Epic, if you change, you have to tell them.
Oh, we've already said they look at your
It's in a
taxes.
bag and it says Israeli couscous, they're round, and I think it has vegetables in it.
How about question 40?
Question 40. All right, question 40 for anyone that can't read it says, the following cannot be credited toward meeting the Medigap plan waiting period up to 6 months for pre-existing conditions. So this is another process of elimination question. We know that lesser Medigap plans, that's something that we do tell clients, if you are looking to avoid the waiting period or get around the waiting period, you can use your lesser Medigap plan to fill that waiting period. VA healthcare also does count towards it. National health plans for another country, as long as you are there and not retired, you're working, they count as well. But original Medicare, after the first 6 months of Medicare eligibility, does not count. That's the answer, original Medicare after the 6 months of Medicare eligibility. And that,
I think the thing that confused me was that the another country's coverage. I didn't know if that was creditable, but you're saying that it is.
it is, as long as they're not retired in that country, as long as they're working in that country and they are under their national health plan. If they're retired, it does not.
Thank you. I did not know that. May I ask another question?
Absolutely.
48. Like I have to admit, I get confused about the tiers and stuff.
Okay. All right, so 48 regarding requesting a tier exemption. So 48, for anyone that can't read it, says beneficiaries can request a tiering exemption from their Part D plan to have which types of drugs covered at a lower cost sharing level. Now the options here are preferred brand covered at generic tier, a non-preferred brand covered at a preferred brand tier, and a specialty drug covered at a non-preferred brand tier, or any of the above. Now it's obviously not any of the above because that would be pandemonium, but the answer is actually I believe it's a non-preferred brand name drug covered at a preferred brand tier. Let me double check that. Yes, okay. That is true because, because the non-preferred brand drugs are usually right beneath the specialty drugs. Specialty drugs they can't be tiered exemption. It doesn't work. You just can't do it. It's outside of the rules. Let me see if I can pull that up. No, I don't have it. Okay, so specialty drugs, that's a no. Those don't get, specialty drugs are fresh off the market. They're new, they're sometimes not, they haven't been used for that long. They're fresh, they're right out of the lab. They're not usually covered for a tiering exemption. Now, preferred brand drugs, they're already preferred, so they're already in the system. They wouldn't tier it down another level. But the non-preferred are ones that are the very expensive drugs, the ones that are tier 4 and the ones that really weigh people down. But those can be bumped down to a covered drug. Now, preferred brand can't go to a generic because they're already covered. A specialty drug can't because those are just the rules. Specialty drugs don't get a tier exemption, but the only ones out of these that do get the tier exemption are the non-preferred brand drug, and they get bumped down to a preferred brand tier. And the way to do that is to speak to your prescribing physician and see if they'd be willing to write a letter on your behalf explaining why you need this specific drug and why you cannot do without any other drug, and then see if your plan will make a tiering exemption.
Can we go back to the one that you did before? I have a question about changing a Medigap from a lower, like an N, to a full G in the middle of the year.
Which question was that?
Well, it's not the question, it's the subject, actually. I want to know if anybody has expertise on it. You know, when I've gotten the question come up in the lectures where, you know, we tell people they can change during the course of the year from a lower Medigap to an upper one, to a more expensive one. Mm-hmm. But I want to know, like, somebody will learn that they have an expensive operation coming or something like that. Mm-hmm. And they want to change, or they want to go to that more comprehensive plan.
Yeah.
But somebody told me in one of them that they were made to wait for the operation a good number of months. They couldn't like do it immediately when they changed into the more comprehensive plan. Can anybody enlighten me of how that works? When you tell somebody you can change any time of year, what are you telling them? That you get everything immediately that's in that more expensive Medigap, or that you have to wait for some things, or that you just physically allow you to change into that plan, but you don't get the benefit of everything from that comprehensive coverage quite yet?
I always assumed that you got immediate coverage, but that was just an assumption on my part. I don't know that.
I haven't heard anything to the contrary. So the situation you're describing is a little bit strange. You said that they switched to a higher Medigap plan.
Yes.
And then they were made to wait.
Yes. Huh. And I couldn't understand it because I assumed you could get anything, but then it made sense. They haven't been paying into it. now, they want an expensive operation. Maybe they make them wait to pay some more money months into it. I don't know the answer. And I don't think I was able to find the answer on that.
I guess we could call one of the Medigap companies and see what they say.
I've never been able to do that because they want me to apply.
Right.
So that's something that I would love you to explore. What actually happens? I'm in February, let's say I'm in a lower plan like an N. And then doctor says, oh my God, you're going to have such heart failure soon. So I go in March to go to the big plan.
Mm-hmm.
So will they make me delay on waiting for any of that big expensive care or not?
And when you say they, do you mean the physician or the insurer?
The insurance company, yeah, to cover it. Even
Okay.
take it worse, take it like you go through June or July, August paying cheapo, and then all of a sudden September you get the bad news and you want the big plan to cover the rest. You paid so little. Why don't we all game it that way?
Well, so Julie, maybe those of us who have Medigap plans should just call.
That's true. That's true. Yeah, I don't have one.
I'll do that.
Could you please? I'd love the answer to that.
It's curious because as I said, I always assumed that you'd be covered immediately, starting the next month. And if that's not true, I've been giving bad information.
Me too. I know. I was frightened.
Yeah, I'll call.
Thanks.
Julie, we've had experiences, and as a matter of fact, there was an attorney that used to be a counselor who used to switch back and forth from a high deductible F to a regular F during periods when he was suffering from a long-term illness, and when he knew he needed a surgery and he just wanted to go on to F, he would just switch over. And that was part of his selling of high deductible F, or that G wasn't around then. But I think that you can switch and be covered.
I think it also depends on the insurance company, how they honor the pre-existing condition.
I thought they were allowed to absolutely must operate the same way as far as that's concerned.
They don't have to operate the same way. That I know.
When it comes to pre-existing conditions, no, they don't have to operate the same way, but otherwise, yes.
I thought that pre-existing conditions was determined by New York State.
It's not whether they have to handle pre-existing conditions. It's when they start covering pre-existing conditions.
Okay.
And they can handle it differently.
Yeah.
Now, this is probably something I should look up myself, but question 23, I'm never entirely sure of who you contact with what problems.
Question
23.
23. All right, so this is a wonderful learning question because the answer is all of the above. So when it comes to who to contact for what, the BCRC, the Benefits Coordination and Recovery Center, they're the individuals you want to contact when you have a coordination of benefits issue. Let's say there was another question here that actually touched upon that. Let's say you have retiree coverage and you also have active employer coverage through a spouse. If you had any questions or you were confused or you feel like something was charged incorrectly to one insurance for the other, or you wanted to know which one would be charged, you'd be able to call the BCRC,
Question are you doing?
Excuse me?
You're doing question 23.
23, yes. So you'd be able to contact the BCRC and they'd be able to run you through it as long as you have your name, the insurer's name and their address, and your policy number, all of your numbers that go along with your insurance, they'd be able to run that. and help you understand what goes to what. And if you have any issues and which one gets billed first and all of that, you can give them a call and they can help you out with that. Now, it's like I said, there's a learning question because all of them are true. So all of these are true. You can contact them for any MLTC programs or any MLTC plans that you have trouble with. Now that really means anything. If they're not, let's say for example, if they scheduled transportation for your MLTC and this is the 12th time they've canceled on you, you can speak to ICANN and they will oversee and they will take care of that issue for you. They are your representative that you can speak to that is supposed to handle that issue for you. And the same thing for Levanta, our BFCCQIO. They handle quality of care complaints when it comes to, I believe, not home care, not nursing homes, assisted nursing facilities. That's when it comes to
Being discharged too quickly.
Yep.
yes.
Right.
Juan, could you just kind of summarize about managed long-term care plans?
Like what they are?
Mm-hmm. Yes.
Okay. So managed long-term care plans are plans that are offered through the Medicaid system. They are more of an all-inclusive plan. Here, let me just pull up, because the purpose of this is to show you that you can really find anything on any of our 3 resources. So I'm going to see if I can find the answer on Medicare Interactive page.
Vaughn, your voice is not coming through all that clearly any longer.
Can you hear me now? Any better?
That's better.
Okay,
Better.
good. I
A
will
little better,
project
but
it.
there's background there. Kind of an echo or I don't know, it's
Something's rattling around.
That might just be AC, but I don't hear anything else.
okay.
I'll see what I can do to fix that next time. I'll see if I can get headphones or call in or something like that. But you can hear me clearly, at least for now, with a little bit of background noise.
Yeah, it's better.
Okay, great. I'll try and project a little more.
I think it's your Wi-Fi, Vaughn.
It can't be because I'm connected. I'm plugged
Oh,
in.
you are?
Plugged in.
Okay, it's a vibration noise.
Vibration. I don't know, but I'll triple check that when we're done here to figure out what that could possibly be. I'll do a demo with someone else. Okay. So MLTC plans are used mostly for home care, including personal care and skilled nursing facilities, and they also pay for the other things that are listed right here to provide that sort of coverage, including adult day healthcare. But like I said, they're kind of all-inclusive plans that provide all of these different type of coverages when it comes to long-term care, like nursing home coverage, all this physical, speech, and occupational therapy, podiatry, audiology, dentistry, and optometry, and all of these that are listed right here. But like I said, if you ever have a question regarding any of these, those 3 sources will be your best bet. The Medicare New Handbook, the HICAP Handbook, and this website, the MedicareInteractive.org. They actually are the ones that host the test right here. You can see that it's on the MedicareInteractive.org website. So everything that is on here, any questions that you have, please feel free to use their website for
Thank
all
you.
of your questions.
Thank you.
All right, we're approaching 11 o'clock. Does anyone have any last questions? Okay, if that's all, I guess I'll stop talking. If anyone else has anything else to say, please. Okay, so if that's all, I'd like to thank you all for coming and joining. It's been a pleasure. Like I said, I'm going to send you that email with what was sent to us by Heather Reddick regarding where you could find the test, what your best resources are for taking the test, and the deadline for the test. Because we do have a considerable amount of time, but it's better to get it done sooner rather than later. You can take the test as many times as you'd like, and once you take it once, it'll show you everything you got wrong. It's a learning type of test, not really a get it right the first time type of test. So unless anyone else has any other questions? Or any other
Yes,
questions?
I do. We have more meeting to take care of.
Yes.
I'm sorry. Does anybody else want to say anything before? Because there's more stuff to discuss ongoing, and then we can get rid of this in 5 or 10 minutes and we're done. Does anybody else want to speak first? All right, Loretta and I have spent a tremendous amount of time contacting libraries. And it's all documented on there under the on the website. My camera's messed up. I don't know what you're seeing, but I'm just going to keep talking. Every library in the North has been contacted that we want to use their space in case to set up a separate counseling area. Everyone, except I think one has to call me back, Mount Kiss, Chappaqua, I think. But everyone is, they're going to allow the laptop to be used there. Probably they'll let printing, but you have to figure that out yourself if you use their services and use their space and use their laptop. Try to get them to print for you if you have to print a plan finder. I didn't go into that level of detail. They will advertise in their newsletters or their website or their e-blast. They may do that. And they will take our bookmarks and half pagers if we put them out. So it's up to you to, if somebody wants to meet in person and you want to set it up at those libraries, just look at my notes that I put on the Northern libraries. Loretta put notes on the Southern libraries to get a feel for who to call, because some people want you to call the reference desk to tell you're coming. Some people want to call the librarian, the director herself. Some people say it doesn't matter, just call just anybody. But the notes all document what these conversations have had of how to make your connect with the library. That's number one thing. And Loretta, do you have anything more to say on that particular subject?
Oh, I've only done about half of my libraries. What I'd like to say is there's also in a few libraries the ability to schedule a conference room or a study room or whatever their terminology is. And when they do have that, I think they prefer you to do that. So you can schedule a private room for your meeting in some libraries. So you could just look on the website to find out if that's available, or when you call, they might tell you that's available to schedule your meeting. I'd just like to add that there are a couple of libraries that really would like to see us there. I mean, New Rochelle, for one, would love to see us go back and utilize the redecorated space they have for us. But at this point in time, my answer to them is we're just getting going. We don't have all of the volunteers in place yet, et cetera. So we're not really ready to spread out to any other libraries, let alone solicit other libraries for live counseling sessions on a regularly scheduled basis. But there are libraries, as I said, New Rochelle and Greenberg, who are very anxious for us to go. And they're among the libraries that wouldn't mind having us there sometime during open enrollment. So I think that's something we have to keep in mind, how we want to handle open enrollment. Do we want to take them up on their offer to have some regularly scheduled open enrollment at additional libraries?
Yeah, I found that they're 100%. It was absolutely 100%. They want our presence and they want to continue the relationship, not necessarily on the regular basis, but anything they can do, anything they can help us with. That was my reaction. So I'm thrilled that they had that. There was no negativity. It was ready for anything we want to use them for or to ask them about. That's number one.
Does that include Larchmont Library?
That's for Loretta's. I don't know what she's.
I haven't gotten contact with Larchmont yet, or Mamaroneck.
The next news is that Jade did set up something in the North Katona. She set up an ongoing once a month called, interesting. It was interesting. She calls it senior senior entitlements. She couples Medicare with one other topic. Last time she did it in, I think her other place is White Plains. She has a session where she picks a topic. So it was Medicare and dental last time. So she'll tell them in advance, the library will book it. It'll be once a month. They'll allow up to 10 people in it. Absolutely no counseling. So it's more like a Medicare Minute situation, but of her choice, what topic, extra topic she wants to cover. If anybody wants to set up something like that, that's outreach as well. That's entirely up to you. She self-generated that. So as far as I see it, there are 4 components to our program, and each feed the other so intimately that you can't disconnect them. The counseling for sure in the civics, the live one in the Hart and Yonkers. If there's any others that develop, fine, that would be good. The helplines is number 2. These ongoing outside presentations like Jade is doing and Linda does it for, wait, remind me, St. Augustine, you're still doing that on a regular basis, right?
And Armonk.
And Armonk too? Yeah, so you guys, that's an ongoing monthly thing.
Yes, and I'm doing it at Eastchester on Garth Road.
Oh, I need to know that because if you look at the documentation, we're trying to build that documentation. So anybody who has these private arrangements, I need to know that so I can put it in. Sharon, that's which, Eastchester, Garth?
Garth Road.
What day of the week?
It's once a month, usually on a Wednesday. They only meet on Wednesday and Friday, but they're not running through the summer. They're closed on July and August.
So normally would it be the 1st, 2nd, 3rd, 4th? Which one?
The 4th, because we've been getting the Medicare Minute very, very late.
Oh, so you are actually doing it's a Medicare Minute.
Yes.
Okay, so is there anybody doing officially a Medicare Minute of the people who are now involved? All right, so Medicare Minute, 4th Wednesday of the month. I'll put that in. Do we need to know the time slot? What time is your slot?
Usually 11.
11 a.m. All right, I'm adding that later. So if you set up something regular like that, it just has to go on this because this documentation center has the record. We never meet in person. This is where you can go to find things. And we found that very useful in taxes to communicate with people offline. The one thing that has become clear in this 2 weeks of working hard at this is some aspects of promotion which are sticky. So, but in this time period, we have kind of established ourselves as a there's a trio going on here. There's us, self-generated, self-promoting, self-invigorating, self-studying. There's the Diane aspect, which is the SPS, which is focused on high cap and certification and making sure we're conforming to state regulations of volunteering, confidentiality. And then there's the library. Now the library we've had history with. Library still is mounting demystifying strongly. I can't tell you how strongly the support there has been. So there's 3 prongs here. And when we talk about ourselves to other people like the press or the libraries or centers, it's the object would be to convey that it's a 3-pronged situation. Diane has given me specific wording about it, but it's not that one of these components dominates or tells the other one what to do, except in the case of actual certification. That's clear. It's collaborative by all means. And I want to please be sure that everybody understands that it's really, we need all 3 parts to make this work. We can't exist on our own because who would be printing? Who would be sending out flyers? Who would be sending things to a printer like those bookmarks I want Krishna to do? They're printable things that look better on hard copy, not on a Xerox machine. I'd love the library to continue to do that. So we need the input of all. Now, here's the problem. Krishna has issues with his life now. He's undergoing so much change and he's away until July 6th. And then he's going to go away for another part of the summer later. To ask him to sort out the website, which has really a lot of errors at the moment. The WLS website has wrong links, wrong pages, still mentions civics. I put together a 4 or 5 page document of things that need to be changed, but I don't know when he's going to get to it. So as I was talking to Vaughn before the meeting started, if we do use our promotional information, then we should or tell the libraries, we should say that it's not that it's undergoing construction, the WLS website, it's just that the changes have to be instituted there because we are under construction and there will be changes on that WLS website. And I don't know how soon he's going to get to it. Does anybody have any feedback, please? It would help me to know. Should we send out the news articles to the papers? They're ready to go. I just want to know, should I send it out with one link, demystifying link that's mentioned in their works, but the other one to senior benefits is something that needs cleaning up? Should we send out these kind of news releases about our program to get it going and not waste the whole summer, and send it anyway and say that the library will sort, because of the transition, the library will need a few weeks to sort out the presence, the online presence? Or should we lose these few weeks in the summer of getting this thing going, and it's getting closer and closer to open enrollment when people want to change. We want the word out there way before it, and send these kind of quote press releases anyway. Does anybody please help me? I don't know what to do. I haven't sent it out except to Senior Voice yet because I have an ongoing relationship with her.
Julie, I just like to add that the links have been there the way they are for years. So people that are using the links are already, or if they see the link and they follow the link, they're going to be led to the wrong helpline, or they're going to be led to the old helpline number, which now may tell them to call another number. So it's not any different than it's been, and it won't be any different until Krishna and whoever fix the links. So I don't think we're making things worse. Actually, I think we could be making things better because our publications and what we're sending out now are telling people to call the new number. So any person that gets the new number over the old number, we're ahead. We've caused them less aggravation, but I don't think we'd be causing more aggravation because they would have to be calling the old number, or, follow the link that they might have followed before or they didn't follow before anyway. So I don't know that there's a reason to pause.
Okay, so the release, in quotes, the news article that I'm planning to send out has the new senior benefits link, not the old one, and it has the new helplines on it. But when you get to that, if you use that new link, it's incomplete, skewed, needs fixing because it doesn't describe the totality of our programs in a good way. It also adds other helplines to call at the bottom. He has to get rid of those if we want him to use our helplines. So, or put it in a different way that, yes, you can access that.
Don't put the link in, Julie.
What'd you say?
Don't put the link in.
Don't
put the phone numbers in. Don't put the link in until it's up and running.
Well,
no, I have to put the link in though, because I see what you're saying, that senior benefits link. All right, I can leave the demystifying link because that works, but the other one that looks skewed towards demystifying, I don't think I should do that. I think I should put the senior benefits link in because otherwise it looks unbalanced.
I think the link should stay in, and if the people follow the link, they're just going to go around in a little bit more of a circle. That's
well, they won't now because I'm not putting in the old link. I'm putting in the new link, but he has to fix the page. They're not going to go around in circles. It's just not a good page. It's not portraying us the best way yet, but it works. It's a link that has the information about heart and will and all of that. So it's not going to go around too much in circles. It just has to be cleaned up. That's been a problem. But he's out of commission till next time. So does anybody have an opinion then before we sign off? Does anybody want to know what to be discussed next time? Update? Do we need to delay for a month instead of next 2 weeks? That's another possibility. Do we want the full high cap exam one by one before we take it? Do we want to go by one, question by question? Not to discuss necessarily, but just to go over the answers?
I would, yes.
All right. So the next week will be a one by one?
Yes. It
Okay.
should be.
And then we'll take the exam and get certified by mid-July. And yes, send out these informational things to the newspapers, yes?
Yes.
Okay.
Okay. All right, that's all I have.
All right, I have to ask a question to Vaughn.
Yes.
I'm Sharon Moskowitz. I'm sorry I've never met you before, but it's nice to meet you. Diane Punai told me to get in touch with you, being that the Medicare Minute was not coming through with a lot of great facts or written well. And so she suggested that I ask you if we could, instead of having a Medicare Minute for those of us who are still going out there doing it, could it be more of a newsletter that, you know, new information that it's coming down the pipes that would be pertinent to these people? We just want them to be knowledgeable about their rights and what is available to them and what is not. For example, the last time something that came through Diane's office about all the things that are covered by Medicare, the different tests and the different inoculations and such, was a wonderful chart. And I gave that out to all my seniors and they were very appreciative. That was very, 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 very good. In terms of the hospice care, which was the, you know, topic, they were also very knowledgeable because quite a few of them had experience with it, and it really stirred up a very good conversation. But you know, that's not always the case. So
Sure, they're not all gems. So this newsletter, it would replace all the time, or would it replace some of the time?
you know, I'm happy to include the Medicare Minute if it's, you know, if I can recognize what's on there. You know, I found a lot of mistakes, but of course I didn't give that information to them. But anything new that would be coming down, you know.
Sorry about that, Supervisor. So I understand what you're saying, Sharon.
Yeah.
I think we should take this conversation off of the live call because we are a bit over time, especially, and I don't want to hold everyone. Everyone's been so kind to even join this meeting. I appreciate it. Thank you so much. But I'll give you a phone, or can you give me a phone call? Can I give you my phone number? And everyone should have my phone number.
Yes.
It's 914-813.
I didn't hear you. I'm sorry.
914.
Yes.
813.
Yes.
6389.
6389. You got it. Okay.
Give me a phone call. We can talk about that in greater detail. Now, the last thing I wanted to mention was the confidentiality documents that I sent out. I have received it from the majority of everyone. Thank you so much for sending that in so quickly and so correctly. I really appreciate it. For anyone that hasn't, please send that to me as soon as possible so we can get that into the system and we can make sure Diane can sign all of them and that we're all square to go.
Okay, great. Thanks, Vaughn.
Okay. All right, if anyone doesn't, if there is nothing else to talk about, we are over time and I don't want to keep anyone else have anything?
Thank you.
Julie, I see you speaking, but I don't hear you.
I'm sorry. I'm trying to keep it quiet. This was never designed, I think, to be an open and clear cut like a business. We're not running this as a business. We're a bunch of people trying to help people. So if anybody has anything more to say, just say it. And then we, you know, I don't think it was designed roughly try to keep it short as possible. But do you anybody have any?
Juan's on a time limit. Let him go. That's it.
Yeah, you.
No, it's not me. I just know that everyone here is kind enough to even join the broadcast, and I appreciate the time that you do give, especially in the counseling. So just, I want to.
Yeah, but we also know each other a long time, so it's good to see them. You know, we're giving up the in-person because this is more convenient, but we're still chatty type of people. I don't want to turn this into business. We stopped earning a long time ago. You know, it's just a different flavor here. So, but if you have to go, we appreciate your participation. some
I
of you
think
do have.
Michelle has a question.
Julie, can we just confirm when we're having our next meeting?
Every 2
which
weeks.
will be- And it'll be the whole test that in 2 weeks.
And then next week, because it's summer, we may want to lighten up and not do it. On the other hand, you know, the 2 weeks after that, we may want to skip. But anything you skip coming up into September is getting closer to open enrollment. We may want to keep it going.
Right.
There's things to do. Just know that that website there, the documentation center, is open for you. Like, for example, that green letter, blue letter that I stopped you for, I put that whole chart on it days ago. You know, so there's things in there. Every time Diane sends something, I should mention, she gave me permission as that as well. The HiCap coordinators meeting, which is a high-powered, high-level meeting every month, is recorded. And I asked her to send me the link because they speak too fast for me to take notes, and sometimes too quietly. I don't know the subject so well, so I can't catch notes. So she sends me the recording the day after or 2 days later so that I can take notes on it if I want to. But then sometimes I may not want to take notes. So I asked her, can I put that whole meeting up in the recording section? And she said this morning, she said, we confirmed, yes, the whole meeting can go up. And the reason why I can provide you that link is because our whole website is by invite only. You can't give that number out to the public. It's not shown by the public. So you can see if there's in that website that we have, the documentation center, under recordings, there's a paper, a doc, where I put links to our meetings, where this is recorded now. Loretta will put that up on our YouTube channel now, so you can always go to those. And then on the right-hand column will be the links for any of the outside meetings, like that HiCap coordinators one, or like a Houseman meeting. I don't mount it there because I don't want to waste the space in my drive, but the link will take you somewhere where it is available. And on top of it, I do put in the drive any of the visuals. So if there's a PowerPoint presentation they're talking from, I have a link going to where I do put that up. So you can listen to it and watch it. You can keep the materials and refer to the materials. All of that is in. If you can start playing with the documentation center, you'll see so much is on there, better than ever. Because I'm filtering out and redesigning things in a way that you can get to the things pretty easily. What about the Medicare Minute? What's the next one? The latest one I know about is June. Was there another one?
Well, I didn't look today. It usually comes out like the last day of the month.
Does it? Okay.
Yes, so.
And Vaughn, you'll send that to us?
So yes, once it comes out, I will send you the link for the latest one, but nothing's come out yet.
Okay, so here's a question. Here's a question to you. I only need the script because I don't do Medicare minutes. I don't do handouts, and I find them inconvenient. I want you to send them because people need them and like to look at them. But I personally have only wanting to mount that, not the script, the training notes.
Materials?
There's materials, the 7 pages of stuff. That's what I want to go on the website because that's so informational packed.
Mm-hmm.
But since there's not much Medicare minutes going on, I personally don't need. So Sharon, you're doing a Medicare, Linda's doing a Medicare minute. Is yours Medicare minute, Linda?
Yes, but I also put in information that I know the particular group is looking for.
Yes.
Looking for. Yeah, so we've always revised, those of us who have done Medicare minutes in the past always kind of take from here or there. So what do you want? Let me ask you guys, what do you want me to mount? The Medicare minute plus the handout plus the script, or just the materials? Which one do you want? All of it.
Everything.
Yes.
All right, I'll put them in, and then like 6 months later or at the end of the year, I'll take them out and start again. Every 6 months every month I can take out the 12 months ago
Yes.
type of thing so that it doesn't waste space. I have a space thing. He's working in an office with space. I'm using my own drive. So I want to control the amount.
Right.
Okay, I'll do that.
I'm gonna say goodbye.
Yeah. Bye.
Bye, Dorothy.
Anything else?
Bye, Vaughn. Thank you.
Thank you.
Goodbye, everyone. Thank you for joining. Thank you so much for all your hard work, everyone. Take care.
Bye-bye.
Thank you.
Bye-bye.